Hello, my name is Dr. Fleur Chong from the Amsterdam University Medical Centers in the Netherlands. On behalf of my colleagues, I'm excited to present our results in this presentation titled Device-Device Communication Stability of Leadless Antitachycardia Pacemaker and Subcutaneous Implantable Cardioverter Defibrillator over 18 months. As you all know, ICD therapy is well established and first-line therapy for patients at risk of lethal cardiac arrhythmias, but it's still associated with complications leading to a significant number of reoperations. Moreover, complications related to the transvenous lead, such as infections, have shown to cause high morbidity and mortality in these patients. The subcutaneous ICD has been shown to be a safe and effective alternative to transvenous ICDs, but it lacks pacing capabilities. We know that a small but significant portion of ICD recipients later develops the need for antitachycardia or bradycardia pacing. The proposed solution is the modular CRM therapy system from Boston Scientific, consisting of a combined implant of an emblem SICD and a novel ATP-enabled leadless pacemaker, capable of device-to-device communication for synchronized therapy. The system allows for a more patient-centered implant approach in which we can add the modules only when the pacing or defibrillation indication arises, resulting in patient-tailored therapy and minimizing intracardiac hardware. The mCRM system unidirectionally communicates from SICD to LP using conductive communication protocols, which uses the existing SICD hardware. In this study, we evaluated the mCRM communication threshold, which is the lowest SICD transmit setting at which the LP successfully received the ATP request signal, which ranged from 1 to 7 volts using 0.5 volt increments. We tested the following hypothesis. We expected stable mCRM communication thresholds over time and tested if they might be affected by subject posture, presence of a parsonage pouch, leadless pacemaker tissue encapsulation, and device migration. The mCRM communication thresholds were measured in 3 postures. In addition, we measured the amount of LP encapsulation at termination, and we assessed the SICD system migration radiographically, comparing position orientations of the can and electrode position between day 0 and termination, using a 4-point rating scale. We used different statistical approaches to test for communication threshold stability over time and looked at interference by other factors and tested for it using a repeated measures generalized linear model. Here are our main results. Device-device communication was successful in all 1,081 attempts performed in 37 canines within the study. Communication thresholds were low and stable throughout follow-up. Only 8 individual measurements exceeded the 4.0 volt nominal setting, each of which was observed in only a single posture for that given follow-up time, and each of which decreased to a value below 4 at the next follow-up time point. A statistically significant but clinically not meaningful decrease in communication threshold was observed between implant and day 3. No statistically significant difference was observed from day 3 throughout month 18. The 37 canines were implanted with a ranging follow-up time between 7 to 18 months. LP tissue encapsulation ranged from 6% to 100%, with mean and median values around 60%. The SICD system was not designed for canine subjects, and their looser skin and postures activity differ significantly from the human implants. mCRM communication thresholds for each posture at termination procedures versus LP tissue encapsulation and parsonage pouch use are depicted graphically on the upper graph. No statistically significant influences on mCRM communication thresholds were observed for subject posture, parsonage pouch use, percentage of LP tissue encapsulation, or SICD system migration. So in summary, mCRM communication thresholds are low and stable over time. and were unaffected by other factors such as LP encapsulation, slight to moderate SICD system migration, subject posture, and Parsonet pouch use. So in addition to our conclusions, I think the study has 4 important outlooks to consider. This is the first step towards clinical application. We expect a clinical trial starting soon. These systems present us with an opportunity to provide a modular approach, allowing physicians to have more flexibility in the treatment of their patients, and has the potential to decrease intercardiac hardware and further optimize and personalize CRM therapy. Moreover, bidirectional communication may further reduce trade-offs between the SICD and transvenous ICDs. And finally, this novel concept of communicating modules could pave the way for future multi-component leadless CRM systems. I thank you for your attention.